Hello everyone. My name is Jordi Piera, and it's my absolute pleasure to be here with all of you. I'm the director of the Digital Health Strategy for Catalonia, and I'm also content coordinator and lecturer at the Executive Masters in Digital Healthcare here at the Barcelona Technology School. As you know, we at the Barcelona Technology School help people to shape the digital future. We have students from all over the world, and we want to lead a digital transformation, build and manage digital products, discover and activate data-driven opportunities, and design user experiences able to build unique spaces between users and technology. And today I'm pleased to be here with you all and with my good friend Adriano Fernandes, who is the head of innovation at Santa Casa de Misericordia de Amadora. And today we'll be talking about citizen-centered innovation and how I would say an organization in the so-called third sector, in a charity concretely, such as Santa Casa de Misericordia is, manages to innovate in their service delivery and cover needs of citizens which are not truly covered by the welfare state. So let's start maybe first before the conversation by getting to know our other panelists. So Adriano, can you let us know a bit who you are, which is your background, and maybe which is your role at Santa Casa?
Of course. First of all, thank you very much, Jordi, for this kind invitation. And as you said, more than partners, we are friends for a long time. So it's a pleasure for me to be here with you. And I also like to thank the Barcelona Technology School for this opportunity to be here. So let me tell you a story about this, because if I just tell you that I am a head of innovation at some organization or a specific organization, all of you will know thousands of them. So I'm used to introduce myself as someone that is furiously passionate about people. That is how I came to describe myself after reading this sentence on the back cover of a book, and it really impressed me. From then on, I kept these words as I felt they perfectly expressed my feeling in relation to the personal and professional fulfillment that I find in supportive relationships. When I was born in 1976, my father was 59 and my mother was 43. We noticed very soon that we would have a short period of time to be physically together. My parents were my superheroes, so they were always giving me their super energy, their super love, and super protection. By the time they started to be frequently ill, I was not prepared to it. I was not prepared for their incapacity to continue exercising their superpowers, and I felt I was being selfish and that I was increasing their anguish. From then on, 23 years ago, I understood that my personal and professional fulfillment would always be based on supporting people and organizations that are in a challenging situation, either social, financial, cultural, or structural. And I do it side by side, active listening to them. And this is why I do what I do. I have a degree in sociology, and I am actually the head of innovation at Misericordia of Amadora, providing consultancy, education, and training to people and organizations that need support, trust, systems, process, and tools to overcome challenges and go further. And this is why I am the head of innovation at Misericordia of Amadora. Sorry for the long answer, but now you can understand better why I'm doing this.
No, it's perfectly fine. I mean, maybe also for the audience, because it's not so clear to me that everyone knows where Amadora is, and maybe also, so let us know a bit about Amadora and which is the reality there. It's well, you know, it's a place which is very close to my heart, because I always find the similarities in between Badalona, which is my city, and Barcelona, and I think that you can also do that analogy in Portugal. So let us know a bit about Amadora and the reality that you have in there.
Yeah, my pleasure. So, as you know, because you were here for 3 times so far, Amadora makes part of the metropolitan area of Lisbon. So it's suburban area of Lisbon. It's territory composed of 23 square kilometers for a population of 175,000 inhabitants. So this means that Amadora is the region in Portugal with the highest demographic density. Apart from this, we call normally Amadora as a social living laboratory. So we have very challenging indicators regarding health, social needs, and other social and demographic indicators. Just for you to know, 19% of the population is aged over 65 years old, and of those, 42% are aged over 75 years old. We have a high representativeness of older people living alone at their houses. We have 50,000 unemployed people, and we have 3,000 people with very low educational skills. In what regards healthcare indicators, just some numbers, 7.2% of the people suffer from diabetes, or 20% are hypertense, and we have a rate, for example, of 17.7 of death by ischemic cardiac disease, and also a rate of 15.6 of mortality associated to stroke. So this is linked to some challenging conditions in where the people live here in Amadora. And let me tell you that the municipality is doing a great job to rehouse all of these people in the past 15 years. So the situation is increasing for better, but we still have some challenges. So I think in summary, this is how we can describe Amadora.
I keep on seeing the links with Badalona. I mean, Badalona, it's 20 square kilometers, and it's 240,000 people living in there. Yeah. And I can tell you that half of that, well, a great part of that is mountains, some hills, which is empty, but we have the streets with the highest density of population in Catalonia and in Spain. It's quite crazy. And well, it also links a bit with cities, right, being a great source of opportunities, but also a great source of social challenges. And I would say, in order to solve, obviously, Portugal, also Spain, it's states where the politics in here, it's the implementation of the welfare state. We have the social pillar, the education pillar, the social security, and also healthcare. And well, most of the times we see that the welfare state is not able to reach or to cope all the needs of our populations. And then in there you have this organization, which is called Santa Casa de Misericordia Amadora, which is trying to cope with these needs of this, well, the needs that the state is not able to deal with. So can you say a bit also on Santa Casa, a bit of the story and a bit of the objectives of the organization, and which are the main activities that you perform in there?
Yes, of course. So as you all know, there are 1,200 misericordias spread across the world. In Portugal, we have 398 misericordias. Of those, 397 are NGOs or charities, so they are private organizations, and we have one, which is Misericordia of Lisbon, that has a semi-public status, so which is different from all the other Misericordias. And our organization in Amadora we have only 36 years of existence, and the majority of the Misericordia have more than 200 and 300 years of existence. Why is that? Because until 40 years ago, Amadora made part of another council, which is Oeiras. So, and you can only have one Misericordia per council. So when Amadora started to be a council, this Misericordia was funded. was founded, sorry. Responding directly to your question, the Misericordias should address the specific needs of the specific territory and population. So in our case, we have 4 main core business areas, which are social care, healthcare, education, and what we call our older adults area. We have a workforce of 530 employees, so we are not talking about volunteers, it's paid staff, and we reach daily 5,800 people here in Amadora. We are the second biggest employer of the council if we exclude the companies, the profit sector, because we have some big companies here in Amadora. And we are the second because after the municipality, we are the second biggest employer. One of our also interesting core values is that 52% of our population, of our employees, sorry, had a previously vulnerable background in what regards their social and economic situation. So this means that a client can enter in our service process model as, for example, benefiting from a minimum income from the government, and we promote capacity building among them. We try to empower them, and then we hire them to work with us. So again, responding directly to your question, we are a strategic partner of the government through the Social Security Ministry and the Healthcare Ministry that operates in the field directly with the community, because we have been demonstrating, proving to the government that these organizations that are based in the community are the ones that better can do the job, of course, but more than that also can save money from the government, because we know the needs, we know the people, they trust us, and we are the ones that better can support them. So in our 4 main core business areas, on healthcare, we have a medical clinic, and we have a long-term care unit for big disadvantaged people. On social care, we have a minimum income team that daily gives supports to 1,300 people that are depending on the minimum income. So this means that there are people that are receiving this benefit from the government, which is 190 euros per month. On education, we have 5 kindergartens, and we have a basic and elementary school that daily provides services to 600 kids here in Amadora. And on our older adults area, we have 3 nursing homes for older adults, 4 home care support services, and 2 daycare centers. So this means also that daily we give support to 600 older adults here in the council. And as you know, in Portugal now, the government is very focused on the decentralization of the governance, so passing the executive power to the municipalities, and we are a strategic partner, as you know, of the municipality of Amadora. So we are often invited to accept new challenges, so bringing innovation to the services. So this is why we operate with the government and with the municipality. So we see them as we see this that we do as a service that we are providing to the government and to the state.
Mm-hmm. This links very well with my next question, which is, I mean, well, it's clear that your organization has become a strategic partner for both the government and the municipality. And in there, I mean, it's clear that you are working in these 4 main areas that you just explained us. But then you've been able, and this is personally you, and also maybe the bit of your boss that has given you trust and confidence to deliver this. On a, I would say, very holistic innovation strategy, which is focusing on the needs of the citizens in Amadora, and that has been or is being quite successful. So what can you say about this strategy towards innovation and I would say, in service patient, or no, say, I would say service citizen-centered innovation, something like this would be right?
Yeah. So before addressing directly your question, let me tell you the following. We have our Misericordia here in Amadora. It's considered as a case study because we are very young in terms of our existence, and we have been able to achieve interesting results. And apart from being so young, and that gives us more chance and energy to internalize innovation and to internalize new ways of governance, there are other what we call critical success factors. So you just mentioned one. Our board is composed of entrepreneurs, of liberal professionals, so journalists, judges, owners of companies, and our board is completely composed of volunteers. Okay, this is our main board that then delegates on our general director, which is Manuel Girão, that you well know. And Manuel Girão has a master in administration. So this is quite important for the way that governance is made here. So if you look at our governance chart, it looks like vertical, but in fact it's horizontal. So Manuel Girão, as the general director, has a team of directors and coordinators that work directly with him, and at that end, he delegates the autonomy and the capacity to take decisions on those directors, and it's very easy to internalize innovation. Addressing the specific question, how we have been doing this here. So we have been very focused in the past years on the change management process, and you know that the participation in the European project gave us the opportunity to start working on this in a more effective way. So we have been moving the organizations from the center to the periphery, to the satellite, and putting the people in the center. So this means that we have been changing our model. So I would say 10 years ago or 12 years ago, as it happens in the majority of the organization, if a potential client reached us, what we had to tell him or her is that, okay, this is our portfolio of services, so see if it fits for you or not. And with this change management process, it's in the opposite way. We have now the capacity to address not only the needs, specific needs of the people, but also their expectations, preferences, in a clear respect for the limits. So by the limits, we mean that if someone tells us, okay, I know that I should do exercise 3 times a week, but this week I just want to compromise with 2, we should respect that. And in a clear respect for their preferences in the way that they want us to provide the services. So this means that we have been launching our integrated and person-centered care model. By integrated, we mean putting the silos of social care and healthcare working together, and bringing technology to the services, because we have been also been very focused on the decentralization of the information. So we are not focusing in the building more physical equipments, more social responses for the community. We are very focused in bringing the service to their houses where they feel more comfortable. So in here, technology also plays a very important role. And by person-centered care, we mean the respect for their needs, preferences, expectations, and limits. So, and complementarily to this, we have been launching our R&D department. So this means that we are daily trying to bring more harms to our integrated and person-centered care model. And I can tell you that apart from active and healthy aging in general, we have been focused on the chronic diseases, palliative care. So these are some good balance that participation in European projects have been giving us, and that apart from putting in the apart from not after the funding scheme ends, we never go back to them again. We take advantage of the good practices and bring them to as new arms to our integrated and person-centered care model.
Mm-hmm. Well, you came into a very interesting point, which I can also relate a lot in, because you followed a similar journey as the one I followed in Badalona, which was, well, let's drive innovation, taking advantage of European funding, but at the same time, I would not say it's just the funding, the one that helps you to rechange your service delivery model, or that fosters innovation, but also getting to know all these smart people from all over Europe, that they have, or they bring in their own experiences, they bring in their knowledge, and that they are willing to share their knowledge with you. And I see European projects not as a source of funding only, but also as a source of knowledge, and well, and friends all over Europe, such as you, because you and me got to meet each other in one European funded project. So maybe for the audience, Adriano, how to get started in this thing of the European projects, where to look for them, what can you get from them according to your view, any counsel that you can provide on that. Now you are super active. I think that you have 5 projects, I think it is, running at the time.
Now it's 9.
which is crazy. So let's speak a bit about that. So first, maybe how do you get in this world, and which is according to your view the benefits, and then maybe we can highlight one of the projects that you would like to.
Okay. So in 2014, Manuel Girão and me started to think about the launching of an innovation department here in Misericordia, as a result of our installed capacity to increase the level of quality of our services, and with the aim of doing it in a more integrated and collaborative way. So in 2015, the innovation department was launched, and by that time we were already participating on Beyond Silos, which was the project in where we met. And then maybe I can tackle here before talking about the track record of our track record of participation in European projects. What if you ask me, what can you say in terms of tips to the people that want to get involved in this European projects framework? And I've been reflecting a lot about this. And as you mentioned, when we started talking, we are friends. But we were not friends before Beyond Silos. So we started to be 2 guys that never met each other. Then we moved to be partners, and then we were able to become friends. And why is that? And here I start to give some tips and some reflection that I've been doing on this. So it's very important to be consistent. So when you find an opportunity to participate in a European project, we really need to take advantage on that. So demonstrate to the consortium of partners that we have the capacity to deliver, that we are accountable with time, with the tasks that we have to do, and we have the courage to take risks. It's important for the consortium partners to know in what can we count on you, and if we move a level further, if you can come with us or not, if you have this courage to assume some risks. And finally, one very, very important thing for me is about networking. So networking is quite crucial, and nowadays we always talk about networking, but doing networking means that we should take care about the people that are participating in a project with us. So we will have difficult times to accomplish the timeline, to deliver the tasks, but we also will have social dinners, opportunities to network with each other, and those times should be we should take advantage of those times to better know the other person, because from my experience is that, for example, and you are a perfect case, a perfect example of this. I know you, Jordi, so no matter in what organizations you are working on a specific period of time, because I will always have the will to work with you. I will always want to work with you, because I know about your skills, about your capacity, about the fact that you are a good human, a good person, a good human. You represent well humankind. So this is a mix in between professional and personal skills. So it's the most difficult part is to get, in my opinion, the first project, because then if you deliver and if you show that you are accountable, you will receive more invitations. So having said that, what are the good environments to be part of? So of course, the Ape on AHA, it's a very important ecosystem to be part of. So going to the events that they organize, participate in the initiatives that they launch. Also, the ECH Alliance is also a very important ecosystem. And Ape on AHA, again, is doing a lot of things like the Innovation to Market initiative, the blueprint. So we need to be aware of what are the trends that the European Union is following for this new Horizon Europe framework. Finally, in what regards our track records, as I told you, in the past 9 years, we have been participating in 11 European projects. Actually, we are participating in 9. So, and another interesting thing is that now we have the capacity to really decide on what are the topics and the teams that we want to participate on, because so far we have demonstrated, as I told you, the capacity to deliver, the courage to take risks, and now we have this reliability to really put our efforts in the areas that where we want to improve. So of those 11 projects, the majority are of course focused on active and healthy aging, on chronic diseases. But now we are also participating in complementary projects that are very important for us, as the team of innovation on educational models, for example, that give us the possibility to transfer our model to the educational area, or digital and financial literacy for older adults, which is a very important topic also for us. And finally, apart from just participating as pilots, we have been receiving invitation to assume the role of scientific and technical coordinators in some of those projects. So right now we are in 3 of those 9 projects, we are participating as scientific and technical coordinators, which is an evidence of the reliability that we have been able to achieve and to gain. Sorry for the long answer again.
No, that's good. So I think that there are some takeaways in here for the audience. So one takeaway that I get from Adriano, and that I'm completely coincidental with him here, the first the tricky part is getting the first project. Once you get the first project, you are made somehow into the club. In order to stay into this club, because you will be partnering with many organizations from all over Europe, here it's what Adriano has been saying all the time, and it's truly being able to demonstrate your reliability in front of the partners. So every work that you had compromised to do, that you are able to deliver, that you are able to deliver on time, that you are able to deliver high quality work. Also, Adriano has mentioned, how to scale up from the roles. So you will start with a role which will be participating in one of the tasks of the project. Maybe one day you will propose to be work package leader. Maybe one day you will be proposed to be coordinator of half of the project, and then, well, you can decide whether you want to coordinate your own initiative. So that's more or less the pathway to be followed. There are another takeaway, and that's because we talk in acronyms, and maybe you did not understand this, the audience, but there's a great source of funding. Let me phrase this differently. The European Commission has historically surrounded themselves by all the stakeholders by different means. Concretely, in health and social care, the last strategy that they have put in place was called the European Innovation Partnership on Active and Healthy Aging, which is this APONAHA, which is the acronym that Adriano was mentioning. Here, the European Commission decided, was surrounded by the so-called quadruple helix of innovation, which is partners from, I would say, it's patients and caregivers, it's industry, it's academia, and it's service provision and government. So that's the four levels. And with this, with the idea to scale up innovations when all these four partners, types of partners or stakeholders interact together. The IPONAHA has served the purpose also to shape the funding programs, and it helped a lot to shape the Horizon 2020 funding program, and it's still ongoing, and it's still helping to shape the Horizon Europe, which is the new framework program for competitive financing at the European level. So this is a place that, in case you want to get funding, you need to be. But there are other sources. For example, you have EIT Health, which is a public-private partnership in between the European Commission and EIT Health. And in there, it's, I would say, also a good source to get your projects and your ideas funded. It's, I would say, closer to the market, but there's many programs. You have the URBACT program, which is focused on cities. You have the AAL program, which is only focused on ambient assisted living. Well, there's plenty of different funding schemes that you should be aware of.
Yeah, so, Jordi, let me go back, because you mentioned a very important ecosystem or one of the arms of the HAPONAHA, which is because you were talking about the quadruple helix and the reference sites. It's also a very interesting opportunity. So, and when I was talking about the courage to take risks, and we have this new call that will be closing on the 10th of June. For new sites that want to apply to be a reference site. So a reference site is a region that is recognized by Europe as a good practice in what regards active and healthy aging. And to be a reference site, you need to engage partners from this quadruple helix. So from academia, from social and healthcare, and also from the profit or the private companies that work on innovation and that can design and deliver solutions based on technology. So, and on 2019, we submitted our first application, and Jordi was always telling me, you should apply for this, you should apply for this. And of the 4 stars that are the maximum that a reference site can receive, we received 3. And we are now working on the submission of our renewal for the reference site. So this is also a very good opportunity to be recognized in Europe for the work that you are doing in your region. And because I think I skipped part of your last question, that was about the added value that the European projects have been bringing to Misericordia of Amadora into our intervention. Let me just give you some examples. So in terms of the organization, it allows us to launch our innovation department. It allows us to trigger our collaborative working between social care, health care, and now the link with the educational area that we have here in Misericordia. Also, it was the perfect environment for R&D activities and consequently test and experience innovation systems, products, and tools. It allows the decentralization of the intervention and the dematerialization of the information. So now we have professionals that can access a system that is online to take better, faster, and more informed decisions. And it also allows us to design and implement our integrated and person-centered care model. And finally, it allows us to coordinate our care model. In terms of our professionals, for example, it was very important for the collaborative work, for a sense of feeling more safe about taking decisions, and also about their functional autonomy. And more important than this, for the people. The results of the participation in this project, the evaluation results, have been demonstrating that they feel more comfortable, they feel more safe, and their well-being has been increasing. And finally, for the informal carers, it is very interesting for us because we gave more time for them to focus on the affection, not to do the things that the formal carers should do, so taking care of the activities of daily lives of their relatives or neighbors, but invest that time on affection and emotions. That is the most important thing for their relationship.
Yeah, well, very good points, Adriano. I have one question or a couple of questions from the audience that maybe in between you and me we can address. There is one question that says, it is important to give visibility to these programs, and they say how to do it taking advantage of digital media and without losing credibility. That's one question, and the second point is how to find partners. So maybe want to answer that, Adriano?
Yes, I can start answering the first question. So you know that we live in a time that we are, all of us, we are completely full of information. It's information all around through social media, through all the different channels that we can imagine. So it's very important to decide on the relevance of what we are communicating. And I'm going to link this with my introduction. If you remember, if I told you that if I started to say that I am the head of innovation at blah, 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 so all of you know thousands of head of innovation. So it's not about specific what you are doing or how you are doing something. It's about why you are doing. So by this, I mean that we should feel comfortable about communicating if we have a clear vision of the purpose or about what, how, and why we are doing that. So, and if we communicate in this way, so what is the added value to the community? What is the added value to the population? What is the next level if you achieve the results? Why are you? Where are you moving on? What is the next challenges? We should really use social media to promote the activities of a specific project, of a specific methodology that you are working on, of a specific result that you achieved, but not only in the way that we show good photos about a specific event. If we have established the real purpose of that, what is the added value for the community, we should invest on that. So regarding the second question, and as Jordi was saying, if, for example, the European Commission funding and tenders webpage, in there you have a dedicated section to find partners. How can I find partners? So if you have an idea about doing something, if you are interested in transferring that idea to other regions across Europe, if you are sure about, as I was telling you, the added value of something, you can go in there and try to find partners that can match with your ideas and your purpose and your vision. And as Jordi was saying, the most difficult part is to find the first consortium of partners, because then it depends on you.
Mm-hmm. In the as Adriano is mentioning, in the funding portal, of the European Commission. You can either try to propose your ideas in there and find partners, or you can go directly into the different into different competitive calls. And in there, if you are interested in this call, you can add your name in there. For this, you need to register your organization. You will get something called the PIC number, which is your unique identifier for your organization. And from there on, you will be able to manage your participant portal and apply for proposals and well, really be able to start being part of that game. So Adriano, I mean, we are reaching an end to this.
You told me we had 3 hours.
It was my pleasure seeing you again, and I'm so really looking forward to see you again face to face, wherever it is in Europe.
Yes.
Just thank you in name of the Barcelona Technology School for your time and for your vision and for your passion on the topic. And also, not only that, but also I would say on a personal level, well, just to be who you are and also be one of those that is working hard to live a better world than the one that we have found for ourselves. And that's, you cannot tell this about everyone that you meet by the street.
I learned that from you, my friend.
So
when I'm in difficult times, I always think about you.
Thank you so much, and yeah, wishing you a great weekend, and also to thank all the audience for your time, and I hope that you have enjoyed this talk and that you keep on attending the Barcelona Technology School talks. Thank you, and have a nice weekend, you all. Bye.
Thank you very much. Bye-bye. Thank you.